Candida auris is an emerging fungus that has an oval-shaped morphology with several budding cells. The first reported case of Candida auris was in Japan in 2009 after being isolated from external ear canal discharge from a patient. For those of you who might have ear discharge, there are home remedies you can look up to help with that. Infections have been primarily occurring in patients who have already been in the hospital for other reasons. The fungus tends to spread in a hospital setting through contaminated surfaces or contaminated equipment. However, more research is needed in order to understand how C. auris is transmitted. C. auris has been reported to cause ear infections, wound infections, and bloodstream infections. The most common symptoms of C. auris when it causes a bloodstream infection are fever and chills. However, the symptoms might not be noticeable because patients who are infected are already sick and in the hospital for another illness. Most C. auris infections are treatable with antifungal drugs called echinocandins. However, some C. auris infections are resistant to the main type of antifungal medications, making them more difficult to treat. In this situation, multiple antifungals at high doses may be required to treat the infection. So how would you prevent getting infected with C. auris? Washing your hands is often a good way to decrease your risk of infection, especially after leaving a healthcare facility. So what's the importance about knowing all this? C. auris is an emerging pathogen that can be deadly, causing 30 to 60% mortality of infected people. It is often multi-drug resistant, which makes treatment more difficult, and it is also difficult to identify due to it infecting already sick people in the hospital. As of March 31st, 2019, there have been over 600 cases of C. auris in the US, with 2 being in California. So stay aware, everyone, and don't forget to wash your hands. Thank you.